And I have very bad digestive problems as well.
What's going on?
Oh, I haven't even gone to the bathroom since last Thursday, but I've always had that since I was a baby. So. When I lived,
Okay.
wait, it gets better. When I lived in New York, and I didn't go to the bathroom for 3 weeks, I developed all the way from my mouth down to my throat, these big, like, sores, white. It looked like I had cabbage all the way down because I couldn't go to the bathroom.
All right, you may be having a...
Yeah.
All right, if you could let everybody else that's back there see now, that'll be great. So what we're doing is opening this up. I'm draining towards her upper inguinals, and I am clearing proximal before I'm going anywhere distal. Please don't try and drain and then open this area up.
The other question, like I noticed that you were coming down this way, but we were like...
The I love you.
Yeah, we were always taught to go...
On the colon. Am I near the colon?
No.
Thank you. Intention. What am I focused on? The only thing is, please never ever go backwards on this, especially with the cups. Somebody was misinformed from a class. They were told to work the ileocecal valve in reverse because I checked with the educator when there's diarrhea. And that is actually an appropriate approach. Work the ileocecal valve in reverse only. What they heard was work the colon in reverse.
Oh, wow.
So they were taking people and forcing diarrhea back. So we quickly got that one. Psoas work. Use that scoop movement. Ha-ha. I didn't even have to have you make a movement to get that with your leg. I was able to get your psoas. It's good. So no more digging on people. And can you all see? All right. So psoas, you can have them do the movement that you know to do, the raising leg, the lowering leg, all of that. We have a special table from Jim Kraft that's cut out. And so we have our client raise their leg and then they come down and fully supported. Their leg is now off the table and stretching psoas. So it's a reverse scoop. So you're going to come in and just grab the psoas and then just let the cup come up. Wow. Great release on that. And no more digging. Same thing with the diaphragm. Would you mind putting your arms above your head, please? All right, I learned this from yoga. I watched people, somebody asked me about hiatal hernia. You can use this movement in yoga to pull it down. Please do not use a cup on somebody with a hiatal hernia or any hernia. You could, yes, you want to bring the stomach back down because it's gone up through a split in the diaphragm, but you could increase the split in the diaphragm. So we only use this for reflux. All those people on the purple pill, watch out. I had it after surgery. My sphincter lost its integrity, my stomach slipped through, and acid started coming up. So they wanted to put me on Nexium. Instead, I did this, and I took a cup, and I did my little scoop movement. Where are you stuck? You all right? Yeah. And pull it down. On some people, you will hear a pop or feel it. You doing all right?
Yeah. Okay. I do this a lot with people on a lot of medications because the side effects to medications is usually constipation.
Mm-hmm. So we were pulling the stomach down here. So for me, I also had to come in, suction and release. I had to tighten my sphincter up. Yes, I can be called a walking sphincter at this point, but you gotta look at all the components. If I don't tighten this up, her stomach's gonna slip right back up again. So look at what happened. Mine was paralyzed by anesthesia. Was that yours? Okay. Now, diaphragm, same thing. You're coming in kind of like I did with here, coming in on a reverse scoop. So line this edge of the cup up, and believe me, we're going to be at all your tables helping you with this today. Line it up with the rib, the bottom of the ribs, slide it down until the top rim gets to the bottom of the ribs, and let the diaphragm come up. We didn't get it. Your diaphragm is way up. How big were the kids?
I only have one.
How big was your child?
7 pounds, 10 ounces.
Boy, that pulled your diaphragm way up. I can see why the scoliosis might be increasing at this time.
It's not really funny, but I worked for a chiropractor and he never even brought me in. I just quit working there, obviously, but he never brought me in to talk about my second x-ray after a year of working because I looked at it with one of the x-ray tech and it had gotten significantly worse since like a year of being adjusted. So
How could you tell the diaphragm didn't come?
It is like a rock. When I get the diaphragm, I can't move the cup because it is such a thick sheath. So I know I'm not getting her diaphragm yet, so I'm just trying to go in and soften up and see if we can start pulling it down. She's somebody I'd have to work with a little more. Eventually I'm going to turn the suction up and really try and grab it. So first time though, I got to keep their trust. I'm not going to do something that invasive. And just by loosening up some of these floating ribs and some of the lower ribs and some of the structures all in here, I'd probably start opening her intercostals next. Just coming in and really, wow. Wow. Look at your face. Is that hurting or is
no,
it?
it's just
Weird. Wow, you are tight. That is amazing. So again, a little twist is always nice. You might twist off